So next one is orgasm disorders. This orgasm disorders involve means absence of orgasm. Sometimes delayed orgasm. Orgasm will happen, but delayed orgasm, or maybe early orgasm or ejaculation. So accordingly, it is categorized into premature ejaculation, delayed ejaculation, orgasmic dysfunction, as well as an ejaculation. So what do you mean by premature ejaculation? From the name itself, prematurely happening. Even though the sexual activity has just happened, or the person is completely into, not even completely into the sexual activity or desire, ejaculation automatically occur without having any control of the sexual activity. So that is premature ejaculation. Second one is delayed ejaculation. Even though after having a long term sexual activity, the person is not able to achieve an ejaculation, and it will take more time to reach to the ejaculation period. So that is delayed ejaculation, but ejaculation will happen. Orgasmic dysfunction. So this means this is the disruption to the orgasmic experience. It may be the absence of orgasm following sexual activity, reduced intensity of orgasm despite adequate stimulation, or a noticeable delay in reaching orgasm. So here the desire will be there, the stimulation will be there, the sexual activity will be good, but having disruptions in an orgasm. That is orgasmic dysfunction. Finally, an ejaculation. It is the inability to ejaculate during the orgasm. Everything will be there, the desire will be there, the sexual activity will be fine, but ejaculation will not happen at any cost. And finally, about pain disorders. So as you know, some of the disorders, male genital urinary disorders itself causing pain, like Peyronie's disease, or you can say in some cases like UTI, prostatitis, or yeast infection or fungal infections, or in case some kind of sexually transmitted diseases like genital herpes, or maybe some kind of skin condition like erosions over the genital area, or intense itching over the genital area. These are disorders will prevent the intercourse, even the intercourse or sexual activity due to these symptoms. So those disorders are classified under pain disorders. So next we will see what are the causes of the sexual dysfunction. So let me ask you one question. Aryananda, kindly message me, WhatsApp me. What all are the different categories of sexual dysfunction? Okay. So next, the causes of sexual dysfunction. The first cause is physical causes. So physical causes means which involve which is affecting the physiological function, like cancer, any infections, diabetes, any type of disorders, cardiovascular disorders, blood pressure issues, high cholesterol, hormonal imbalance, alcoholism, drug abuse, neurological disorders, chronic diseases like kidney failure, nerve damage, recent pregnancy, delivery, recent delivery, or breastfeeding, or if the person is taking some kind of medications like antihypertensives as well as antidepressants. See, these all can cause, sometimes not directly but indirectly, will affect the sexual function. For example, out of these causes, some will decrease the desire towards the sexual activity. Second one is psychological causes. So from the name itself, you can understand what is the psychological causes. If the person is not having any interest, he will not be able to do a sexual activity or achieve an orgasm. So things like concern about sexual performance, feeling of concern about sexual performance. He will think that whether he will be or he will be able to do a sexual activity properly. That anxiety, feeling of guilt about sexual desire and activity, relationship problems, depression, stress, fear and anxiety about sex, self-esteem or body image issues, and the effects of past sexual trauma such as rape, molestation, or a negative sexual experience. All these can have a negative impact towards the sexual function. So these are the psychological causes of sexual dysfunction. So which are the causes? Physical causes as well as psychological causes. So let me ask you a question. The question is for Ashley. Ashley, just list down two causes from physical as well as psychological causes. So we'll continue with diagnostic evaluation.